Hello and welcome back to Paul Explains. This week we kind of have a different sort of take on things. We are actually going through the D.A.R.E program literature, see if that's effective, see if it's not, and we're also going to be using AI to help us. So if you didn't know or don't know what the D.A.R.E program is, personally I've gone through it and didn't really like it very much. It was very much ineffective for me, and the D.A.R.E program is the Drug Abuse Resistance Education program, and this was like a federally funded, massive endorsements behind it sort of campaign to stop kids from using drugs. And in my experience, it did nothing but scare people away from them, and that's not really the kind of education that really is long lasting. Background on the D.A.R.E program, if you're not familiar. Basically, the D.A.R.E program was started in the early 1980s, like 1983, and one of the big people behind this was Ronald Reagan's wife. I forget her name, Nancy Reagan. There we go, Nancy Reagan, and she came up with the slogan, "Just say no." I believe it was in response to like a young girl trying drugs, and she just said like, "Just say no," and then that became like the D.A.R.E program's like basically slogan. They came out with T-shirts, which I'm sure you've seen. They have them on Amazon. You can buy them for like $15 or something. But they just like a lot of people wear them just for like jokes now because everybody kind of realized that it's not effective. It's like kind of something everybody knows in their head, but doesn't exactly talk Basically, about. The D.A.R.E program was taught to like fifth and sixth graders, which are like 10, 11 year olds, and it was supposed to educate them on the dangers of dangerous drugs and how those drugs can basically ruin your life financially and ruin your relationships, different things like that. It actually is showing that it's not as effective as everybody thought it was, especially with the amount of money behind it. So I actually have a few articles here that I just want to mention, and then we'll actually be using AI to help us. So this article, the Project D.A.R.E Outcome Effectiveness Revisited, actually was published online in 2011, but was accepted in 2003. It looked at kids, did follow-ups, and they wanted to see if there was any, like, if it stopped them from drinking, if it stopped them from trying cigarettes or smoking weed or any sort of things like that. And it basically had zero effect, and that's kind of what they detail in that one. The next one up is a, quote, "a multivariate approach to a meta-analytic review of the effectiveness of the D.A.R.E program." And this one actually was interesting because from what I remember, this one actually did see like a little bit of a positive change, but it was more of like resisting the initial temptation to like try drugs. So someone like has a marijuana cigarette and they're like, "Hey kid, you want to try this?" The program kind of helped them say no initially, and that was all that. Okay, and lastly, I looked at an article quick. The title of the article is "How D.A.R.E Works: An Examination of Program Effects on Mediating Variables." And so this isn't like a free article, but they give you like an abstract to look at, which I typically don't look at abstracts, because like I've said before, they're not the entire article. They don't give you everything that they look at, and they're behind a paywall, which is like some of these articles are like $40 to buy, which are just like mind blowing. I think they should all be free, no matter what sort of publication they're through. If this is new literature, anybody should be able to read them. It says that the results indicated the primary effect of D.A.R.E is a change in commitment to not use substances. All right, so as part of this episode, I'd like to talk a little bit about my experience with the D.A.R.E program, because basically it was like taught in like 5th to 6th grade nationwide, and I believe I received it in 7th grade, so a little bit late. I do know people who had it earlier, like 4th grade, which was kind of pretty wild for me, like, to hear. And then a lot of my friends had it like 5th and 6th grade. And my experiences were like not good because it was very predictable. Basically every question that they asked, the answer was always no. And they did run through like certain scenarios, like social scenarios, where you're like offered a joint, or like you're offered like a pill, and like you're just supposed to say no and you just cut it off. And I remember like doing worksheets and stuff like that, and I don't exactly remember if we were like totally graded on that stuff. I can't remember if we were graded on any of that stuff, but there definitely was like worksheets and stuff, at least that I remember. The chief of police of my city, town, basically was the guy who taught it, and like I had seen him before because he's also the dude who does, he was also the guy who did like the fire escape training. So like if there's like fires or any sort of emergency, you're supposed to, go this way, talk to these people, and like make sure your friends are safe, all that stuff. He was the same guy teaching the D.A.R.E program, and you know, my experience was that it was very much a scare tactic into not trying drugs, because basically the way I remember it is, if you try drugs, then you'll get addicted, then it will ruin your life. Very 1, 2, 3 sort of, a very predictable way of looking at things. I kind of would like to use AI as kind of maybe to help us dive a little bit deeper into this topic, and maybe help us, decipher a little bit more about the pros and cons, what they could have done better, the effectiveness of some of this. I just want to show you guys a recording here, and I have gone through OpenAI, which is, I believe it's Elon Musk's, the AI that he had created. And I basically have asked it like a few questions about the D.A.R.E program, and I've asked it about the effectiveness and tactics of it. So I'm just going to go through some of the questions here. I'm going to pop it up so you can see it as well, and we'll just scroll through it together. Detail the effectiveness of the D.A.R.E program. The AI says, the D.A.R.E program is a substance abuse prevention program that aims to educate children and adolescents about the dangers of drugs, alcohol, and tobacco. The program is typically delivered in schools by police officers or other trained professionals. The effectiveness of the D.A.R.E program has been the subject of much debate and research over the years. While some studies have found positive outcomes such as increased knowledge about drugs and more negative attitudes toward drug use, others have found little to no effect on actual drug use behavior. Interesting. Also, what studies say. A number of systematic reviews of the research on the D.A.R.E program have been conducted with varying results. For example, a 2012 review found that the program had no significant effect on drug use behavior or intentions among participants. Similarly, a 2009 meta-analysis found that the program had no significant effect on drug use behavior or attitudes among participants. Could have been one of the ones I mentioned. However, some more recent studies have found more positive outcomes. For example, a 2015 study published in the Journal of School Health found that the D.A.R.E program was associated with lower likelihood of students engaging in substance use compared to those who did not participate in the program. Overall, it is difficult to draw definitive conclusions about the effectiveness of the D.A.R.E program based on the available research. Some studies have found positive outcomes, while others have not. It is important to note that the program has undergone significant revisions over the years, and different versions of the program may have different effects. Additionally, the effectiveness of the program may depend on the number of factors such as the quality of the implementation, the age and demographic of the participants, and the cultural context in which it is delivered. Okay, pretty cohesive there. I don't really disagree with anything that the AI just said. As it's kind of something I've experienced myself, kind of went through, I don't really see anything that really stood out as like wrong to me. The only thing is that the AI is pretty neutral here, and to my knowledge, the effectiveness of the D.A.R.E program is pretty ineffective, and it doesn't really go heavy on the ineffective, which is fine, and that's also part of research, is you want to note the positive outcomes, if there even are some. You want to talk about them at least a little bit. So the AI did pretty well there, I'd say. So next up, why was the D.A.R.E program started? The D.A.R.E program was started in 1983 in LA, California, as a response to the growing concern over drug use among young people. The program was created by the Los Angeles Police Department in collaboration with educators and community leaders. At the time, there was a widespread perception that drug abuse was a major problem among young people in the U.S., and there was a growing concern about the negative impact of drugs on communities and families. The D.A.R.E program developed was developed as a way to address this problem by providing young people with the knowledge, skills, and attitude needed to resist the pressures to use drugs. The program was initially targeted at 5th and 6th graders, but it has since been expanded to include students at various grade levels. The program has been adopted by thousands of schools and law enforcement agencies across the United States and around the world. The goals of the D.A.R.E program are to prevent drug use among young people, to provide information and education about the dangers of drugs, and to promote positive attitudes and behaviors that will help young people make healthy and responsible choices. A couple things here, at least in that response for me. I would like to address first of all, like the last sentence, behaviors that will help young adults make healthy and responsible choices. Obviously, anything you're putting in your body other than food can be deemed as unhealthy, I'm sure, by somebody somewhere. But it's just part of it, I guess. Healthy is it's kind of subjective in a way, if that makes sense. Mentally healthy, physically, emotionally, different things like that. And I would just like to focus on the paragraph here, the last paragraph in the last sentence in the second paragraph. The D.A.R.E program was developed as a way to address this problem by providing young people with the knowledge, skills, and attitudes needed to resist the pressure to use drugs. The acronym doesn't really say anything about, like, when you think about the acronym, drug abuse, what is it? Drug abuse resistance education. So you're, by the acronym, you're resisting you're being educated on the resistance of drug abuse, which, is, that's a good thing to be educated on drug abuse, but it doesn't say anything about scaring people into not trying things, which is interesting. It doesn't say that that was the goal. If that was the goal, wouldn't they have a different acronym? That would be my thinking. Next up, we have, what role did Nancy Reagan play in the D.A.R.E program? Nancy Reagan, we talked about this earlier, so I'll probably just run through this here. I'll let you guys kind of skim through this if you want. Basically, the Just Say No thing was a major, she was the main spokesperson behind that, but the AI gives you a little bit more in depth there. Mrs. Reagan became involved with the D.A.R.E program in 1984, shortly after its launch, and remained a supporter and advocate of the program for many years. She spoke at the D.A.R.E program graduations and events, and used her platform as First Lady to raise awareness about the program and its goals. Pretty interesting, that this came out in 1984, or, 1983, 1984, and it's still relevant. Still relevant, and still ineffective. Boom, mind blow. Yeah, and obviously the AI basically finishes off every little thing about how the effectiveness of the D.A.R.E program is up for debate. And if you talk to people, mostly if you talk to people, and then if you look at a little bit of research, and you can kind of see that it's pretty ineffective. You can feel it out. It's pretty ineffective, And we will get to something that might blow your mind here. So just be patient. I ask it, how much, so this question is, how much did the D.A.R.E program cost? And the OpenAI says, the cost of implementing the D.A.R.E program varies depending on a number of factors, such as the size of the school or community, the duration of the program, and the resources available to deliver the program. However, according to a report by the U.S. Government Accountability Office, GAO, in 2003, the cost of the D.A.R.E program is estimated to be about $1 billion a year nationwide. It's worth noting that the cost of the D.A.R.E program has been subject to debate and criticism over the years. How some critics argue that the program is too expensive, that the funds could be better spent. Blah, blah, blah. Others argue the program's effectiveness in preventing drug use has not been well established, and that the cost of the program may not be justified based on the available evidence. So, kind of interesting, and basically kind of sums up what we know about the D.A.R.E program already. We kind of know that it was a federally funded, a lot of money behind it. I didn't know about the $1 billion thing, but looking on Google and figuring that out now, that number is accurate. And I think for a lot of people, the next question is something they're still wondering. Is the D.A.R.E program still active? And the answer is yes. And the AI kind of expands on this a little bit. Yes, the D.A.R.E program is still active today. It continues to be implemented in many schools and communities across the U.S. and around the world. The program has undergone some changes and adaptations over the years in response to criticism and research on its effectiveness, but the core mission of providing drug prevention education to young people remains. And next up, we're getting into the statistics for the D.A.R.E program, which I asked AI to kind of put together for me. So let's see here. This is the question I asked. What were some of the reasons the D.A.R.E program was started? Provide statistics. Blah, 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 blah. The program was developed by the LAPD in collaboration with educators and other community leaders. Some reasons for starting the program included rising drug use among young people. 1980s, drugs were booming, essentially. Number 2, increased drug-related crime. Number 3, lack of drug prevention education in schools. Okay, pretty important. Last paragraph was pretty mind-blowing. As for statistics, according to the D.A.R.E. America website, the program has been implemented in over 75% of U.S. school districts and has reached over 200 million students worldwide since its inception. However, the effectiveness of the program in reducing drug use has been the subject of debate and controversy, with some studies showing no impact on drug use behavior. So, when you have 200 million students worldwide and 75% of U.S. school districts being taught D.A.R.E, you would think if something's effective, it is more than evident that it's effective. It's like, like gravity. Like, does this paper fall? Yes. If you do that 1,000 times, is the paper still going to fall? Yes. That's because gravity's a thing, right? If the D.A.R.E program is effective, you probably wouldn't have the ridiculous amount of drug use that you still have now. Like, it's just wild that this is still a thing. I definitely found this very interesting, very helpful, and for the most part, pretty accurate. I will say that the OpenAI has been pretty spot on with some language concerns, I would say, at least for this. I am only putting in like less than a line of like a sentence, and it's just kind of giving me a rundown. But in some areas, you can kind of tell there's a little bit of censorship. So, but yeah, that's about it. That does it for the video. I hope you enjoyed. If you want to see more, if you like the AI thing, if you don't like it, let me know in the comments. Make sure you subscribe and like the video. All right, I'll see you guys next time. Have a good one. Later.